The public health impact of addiction, with its high relapse rates and the limited efficacy of available treatments, has prompted the search for alternative therapeutic approaches. In recent time, there has been renewed interest in the anti-addictive potential of psychedelics. The ritual use of ayahuasca in shamanistic and religious contexts is now popular in Europe and North America. Studies in the long term, ayahuasca church members have recorded discontinuation of drug use after starting ayahuasca use. Several centers that offer therapies based on ayahuasca as a means to treat addictive behavior claim higher success rates than more traditional approaches. And in this presentation, I will review the data available concerning the efficacy of ayahuasca in the treatment of drug addiction. Although ayahuasca has become popular among the psychedelic community as a kind of medicine to treat drug abuse and addiction, there are nearly 1,050 entrants in Google typing the words ayahuasca drug addiction. Evidence is weak, fragmentary, and dispersed. Its fame as a potential anti-addiction treatment is supposed mainly by claims from former drug users who recovered after joining an ayahuasca religion, and also by reports from several clinics treating drug addicts with ayahuasca, such as Taquihuasi. Other centers in Peru and in other parts of the world also offer patients treatments with ayahuasca, but few have published any assessment of their interventions. Here we reveal all the fragmentary evidence obtained from the medico-anthropological literature and the reports of various treatment centers regarding the effectiveness of ayahuasca in the treatment of drug addiction. It is important to note that as no peer-reviewed studies have yet been published on this topic, the information discussed can only be considered as anecdotal. Well, how ayahuasca works therapeutically, I think that there are three different approaches. The shamanistic one, where ayahuasca is the tool that allows to entry into the spiritual world, the real world, where the entities that rule the force of the world and nature live. Religious syncretism, there are then the religious groups where the syncretist doctrines directs the beliefs of the community. And then the Sikh, I was afraid to put a suffix to this word because it can be said psychedelic, psychonaut, psychological, well, all the approaches with the prefix Sikh that provides peak experience to induce personality changes. And all of them sharing neurobiological and phenomenological commonalities, as is the increase of relative power of the EEG beta band, enhancing CNA's activity. The ayahuasca experience activation is observed in cortical and paralimbic areas of the brain involved in cognitive control, emotion, and memory. This may be translated as ayahuasca helps to bring to consciousness memories from the past, to re-experience associated emotions, and to reprocess them in order to make plans for future. In the last paper of Traulio that was presented yesterday, they conclude that ayahuasca scenes stem from the activation of an extensive network generally involved with vision, memory, and intention. By boosting the intensity of recalled images to the same level of natural image, ayahuasca lends a status of reality to inner experience. In sum, patients feel that the visions and emotions that emerge under the effects of ayahuasca are real, and if they are real, then one can work therapeutically towards a real new behaviors in the future. Well, there are some evidence. The first one came from studies with ayahuasca members of ayahuasca churches. The first one was the study of Grobetol, where 15 subjects from the UDV were compared with 15 non-ayahuasca users, and although none of the UDV members had a current psychiatric diagnosis, 5 had previously met criteria for alcohol abuse according to this MC3R and ECD-10. 11 subjects had a history of moderate to severe alcohol use prior to joining the UDB, with 5 of them reporting episodes of binging associated with violent behavior. 2 had been jailed because of their violence. 4 subjects also related prior involvement with other drugs of abuse, including cocaine and amphetamine. 8 of the 11 subjects with prior histories of alcohol and other drugs use and misuse were addicted to nicotine at the time of their first encounter with the UDV and ritual ayahuasca use. The authors conclude, for showing these changes of quitting from drug use and abuse, that a common theme was the perceived belief, while the induced altered state of consciousness, that they were on a self-destructive path that would inevitably lead to their ruin and even demise unless they radically changed their personal conduct and orientation. There are another study from Halpern, where 32 regular users, all members of the Santo Daime Church of Oregon. Again, the study found that 24 subjects met criteria for alcohol and drug abuse or dependence in the past, but only in the present time, 1 met criteria for marijuana dependence but was in remission at the moment of the assessment. And of the 24 who had alcohol problems in the past, 6 described church participation at the key turning point in their recovery. There are also different evidences from the study of Doreen Silveira, where in comparing 40 adolescents with 40 users of ayahuasca, member of the UDB with 40 controls, found a tendency to less control use in the ayahuasca group. And in one of our one-year longitudinal studies with a large group of members of Brazilian ayahuasca churches, ayahuasca users showed significantly lower scores than control on the alcohol use, subscales in the Addiction Severity Index, a semi-structured interview designated to assess the impact of drug use in a multidimensional fashion. So we concluded that the ritual use of ayahuasca, as I said, with the I in currently active users, does not seem to be associated with the psychosocial problems that drug of abuse typically cause. Even more, according to our longitudinal study, ayahuasca users take fewer drugs than controls, but have a longer history of drug use before their involvement in the ritual use of ayahuasca. Only one study has published quantitative data on the rates of prior and present drug dependence programs related to the moment subjects joined an ayahuasca church. A total of 83 individuals participate in this research that is published in the book that Via Labate and me will present in a while. Again, 36 participants have been members of the church of at least 3 years. The first part was a list of drugs, and the second part was a series of 7 items based on the DSM-4 criteria. In the list of drugs, the subjects had to mark which drug of drugs they had used in the past and which ones they were currently using. The INS had to score the 7 items, first from the point of view of their past situation and then from the present situation at the moment of the survey. If subjects scored 5 items positively, they were considered drug dependent according to DSM-4 criteria, and the criterion for remission was not to be using that drug in the present. The result showed that 38 subjects did not meet criteria for a history of drug dependence. Of 41 subjects that meet criteria for dependence in the past, 37 had stopped taking drugs, while only 4 remained dependent. 19% of the 41 had recovered from tobacco dependence, 27% from alcohol dependence, 24% from cocaine dependence, 8% from crack dependence, and 5% from other substance dependence as MDMA, solvents, LSD, and heroin. So, anthropological observation regarding ayahuasca useful in religious context, it seems that clear that involvement with an ayahuasca religion may provide a useful alternative for many people wishing to overcome drug dependence. Field research by Riccardi Ricciardi and Lavicalini interviewed informants from the UDV who were recovering from drug addiction after their enrollment in the UDV, found that an existential vacuum was a common primary reason for subjects to use drugs compulsively. Ayahuasca served to put them in contact with the sacred, and having an experience of transcendence allowed them to reorientate their behavior in order to give up drugs. The doctrine also played a major role in the abstinence process as the support from the group, which served as a factor of social cohesion and increases confidence in the recovery. Informants may be filled by the combination of the doctrine and the ayahuasca experience. In another study that was published in PLOS ONE in 2012, we found that people that used to take ayahuasca in the long term compared with the control showed lower harm avoidance, higher reward dependence, no differences in novelty seeking, no differences in cooperation, lower self-directness, and higher self-transcendence. The correlations that maybe exist with the recovery of an addiction in the context of a ayahuasca church may be that this lower harm avoidance maybe allows people to expose to ayahuasca continuously without experiencing the fear that maybe every average people could avoid in order to continue the use and exposing every shortened time to such an impressive experience. But in my opinion, here there are no difference in there are no difference also in novelty seeking, and this maybe is expressing that people who is involved in ayahuasca churches don't look the ayahuasca experience as the other people that used to look for drug experience, that they look more to experience the pharmacological effects. Maybe here in this sample, the subjects are looking for different things, different from the experiencing of the pharmacological effects. And another result that for me is very interesting, that may explain why people that is involved in ayahuasca church may recover from addictions, if the low self-directness, maybe the rules and the doctrine of the community and the religion goals the behavior of the individual, and to feel part of a community may be the reason why people used to have less drugs. But let's see then what is the difference with another approaches. There is one evidence from ayahuasca use in shamanistic context. Is one classical report which also explains the therapeutic method developed in Takiwasi that offers some data regarding the patients treated in the center between 1992 and 1998. They only scored the benefits of the patients as having classified as good. That means favorably development problems apparently resolved thanks to a true structural change manifested upon several life levels. Better has shown improvement with evident structural changes, but vestiges of the original problem is still present. And same or bad, that is a relapse of consumption of substance, although often more discrete, no convincing structural changes, frequent abandonment of substance for alcohol. This seems not a very solid outcome measure, but is the result that we have. Out of the total, 31% were classified as good and 23% as better, while 23% were classified as same or bad and 23% unknown. In conclusion, according to Mabit, with hindsight, we can affirm that about 35% of those who have lost contact with the center are in the end good or better. That's 8% of the total, which means that about 62% of the patients have in the end positively benefited of the model proposed after the Takiwasi Center. When only one takes into account the subgroup of patients receiving a medical discharge, those who have completed the entry program, the positive results rise to 77%. And the last evidence of some kind of benefit of ayahuasca in the treatment of drug addiction came from our group that was supervising a program of psychotherapy with ayahuasca in Brazil. Using personality, psychopathological, and neuropsychological assessment instruments, our team assessed the therapeutic effects of an ayahuasca ritual treatment. It was in the Brazilian Amazon Basin, in the Instituto de Psicología Amazónica Aplicada. The psychological assessments were obtained both before and after treatment, which lasted at least 3 months and included weekly ayahuasca consumption. And the main results for me, although there is a very small sample, is the scores in personality traits, above all in the subscale of self-directedness. There was also positive changes assessed with the checklist 19 Revisite in obsessive-compulsive positive symptoms and anxiety, and also with a tool to assess frontal behavior. We found a good recovery in the patients. And despite important limitations as sample size, the present pilot study provides preliminary evidence suggesting psychotherapeutic effects of ritual ayahuasca treatment in drug-related disorder. For me, the most interesting part of this long and boring talk is that there is a difference in people who are involved in ayahuasca religions compared with people that might be involved in psychotherapeutic process. The main difference is the difference in self-directedness. Self-directedness is a personality trait that is explaining a lot of things, signs, possible personality disorders, until recovery from some kind of psychological problems. The explanation or the reason that is in ayahuasca religion self-directedness is lower than the control group, but the people can be recovered is the explanation that maybe the group is holding the individuals. Something that was similar to the ancient times where we were used to live in little groups and in tribes, and each one used to take care of another one. Today, in our technological isolated world, where we have to go to pay to somebody strange, and in the exchange of money we receive psychotherapy, maybe the main result of the psychotherapy is improve the self-directedness, and that the individual can take care of his life and improve. Yeah. Well, as conclusions, although therapeutic potential of ayahuasca based on the evidence examined is promising, the lack of systematic studies preclude firm conclusions. Ideally, research methodologies should be improved with future studies implementing well-planned clinical protocols with adequate controls, endpoints, and follow-ups. That is the next thing that we'll do in Spain in our research group from the ICES from the foundation. We will try to assess people that goes to to take ayahuasca for the first time, and we'll try to make follow-ups in order to see if there is some more solid reason to think that ayahuasca may be a good tool to quit from drug addiction, or even for some other psychological problems. Well, thank you very much, and for your patience.
Thank you, Jose. So if anybody has any questions, there's a microphone there. I have one question, just in reference to the journal article that you mentioned. Which journal is it going to be published in? Fernandez 2014. In one of your slides, you said Fernandez 2014.
Fernandez was a colleague, was a member of the team.
And which journal?
No, it will appear in the next Pia Labate's book.
It's going to be a book chapter.
Yeah,
okay.
In a book chapter. Yeah.
Pia, you have a question?
Carlos, I have a question. Thank you for your presentation. I didn't understand very well what you mean by the psychological versus religious context when you say self-directness. Can you explain that better? And the other thing, it's not so important, but a suggestion that you don't name, I consider there's a big difference between psychological and psychonautic. For me, psychonautic would give more the idea of like an underground experiment and do-it-yourself, basement shaman, and psychological would more give the idea of a group and a mediator or something more collective. I don't think that psychonaut is bad and psychological is good, but Fábregas before presented IDEA as some kind of psychotherapeutic context and appears as psychonautic in yours, so just a suggestion.
Well, I don't know which word to use, because all words can be used against you. So I prefer to use just sick, and then the imagination of everyone can finish the word as they want. It's like if we engage in this conversation about entheogen, hallucinogen, it's very complicated for my simple mind to get involved in this kind of debates. But answering your other question, well, I'm in love with this questionnaire, with the temperament and character inventory, and I think that the questionnaire explains a lot of things. If you make some dive into it, and there are a lot of studies with different clinical populations and with different kind of treatments that conclude that this scale. I will talk tomorrow a little more in deep of this aspect, and I try also a presentation more enjoyable in order to not get bored to the public. But this personality trait, self-directness, explain a lot of things in the combination with other dimensions of the questionnaire. And one of the things that may explain is the therapeutical change. If you see that people get better in that trait, maybe it's because there have been a more profound change in the personality, because it's a trait that depends of the culture and depends of the relationships with the other people and the relationship with the environment. So to see changes in allow self-directness, by example, explain more than 70 or 80% of the addiction problems. When you administer this questionnaire to people with addiction problems, they consistently have lower scores in self-directness. This is in contradiction with the benefits that it seems that ayahuasca induces when it is used in the context of ayahuasca religion. But I think that have some the explanation is that maybe people is not so care of himself and feels like a part of the community. So this may be a reason to find low scores in this dimensional, in this personality trait. The problem will be if we obtain low scores in this personality trait in people that is not engaged in some community, in some kind of community, because there is the explanation why it becomes the problems. To have a low self-directness, a low capacity to be autonomous in life, because they have now the support of the group. I don't know if I have answered to your question, but I'll try to do the best.
Okay, and we're almost out of time anyhow, so maybe unless there's any final questions. Okay,
thank you,
Jose.